Welcome back. In today's video, we are going to discuss about epistaxis in our ENT series. Contents of this video are definition, peritent anatomy, causes, evaluation, the sites of epistaxis, investigations, and the treatment taken for epistaxis. The introduction to epistaxis, first we need to know the definition. The bleeding from the nose is called as epistaxis. The synonym is nosebleed. So basically what the layman say, the nose bleeding, the bleeding which is occurring from the nose, the medical term is epistaxis. Epistaxis is a symptom and we need to find the local and systemic cause. So, epistaxis is not a disease. It is just a symptom of particular local and systemic diseases. So, we need to find the local and systemic cause for the epistaxis. There is no age bar for epistaxis. Here there are two types of epistaxis, anterior nasal bleeding and posterior nasal bleeding. The children will have mild anterior nasal bleeding, while the elderly people will have a profuse posterior nasal bleeding. Males will be affected more compared to the females, but after the age of 50 years, both the sexes, that is male as well as the female, is affected equally. So in the introduction, what did we learn? That children will have mild nasal bleeding, which is of anterior type. Elderly people, profuse bleeding of the posterior type. Male will be affected more, but after the 50 years, both will be affected equally. Peritent anatomy. Here, what do they mean by peritent? Peritent is nothing but the relevant, related anatomy of epistaxis we are going to study. We're dealing with Little's area or Kisselbach's plexus. The little area is situated in the anterior, inferior part of the nasal septum. So guys, here it is lying in this is the nasal septum, okay? This is the nose, this is the nasal septum. It is situated in the anterior and inferior part of the nasal septum. And it is supplied by the branches of external and internal carotid artery. Both external and internal carotid artery. The four arteries, the branches of which will anastomose richly, and they are forming a vascular plexus here. So I will show you with the help of a picture. You will understand it better. Okay. You can see in the picture here the Little's area, which all arteries are forming. Anterior ethmoidal artery, posterior ethmoidal artery. This is the Little's area, which is nothing but Kisselbach's plexus. The sphenoidal artery, superior labial artery, and the palatine artery. So 4 to 5 arteries together will constitute. From the above, ethmoidal. Okay, you have to remember the ethmoidal. Then you see the palate here, the palate of the mouth, that artery, palatine artery. Then the labial artery. Together they are forming the sphenopalatine. From back here, sphenopalatine. Okay, these 5 arteries you have to remember. Next we move on. The vascular area is the most commonest site of the nosebleed in the children as well as young adults. So the little area, which is constituted by the anterior posterior ethmoidal artery, sphenopalatine artery, palatine artery, labial artery, will together form the Kisselbach's plexus. And this is the commonest site of bleeding in children as well as young adults. Usually what happens, it will get dried due to the effect of the inspiratory current, and it is easily traumatized because of the frequent picking or fingering of the nose. So usually in the children or the people who have compulsive disorder of picking their nose, these people, what do? There is a trauma which is caused to the nose, then resulting in the nosebleed. Okay. Retrocolumnar artery, a vein. This is another vein which is relevant to the anatomy of epistaxis. Retrocolumnar vein, it runs vertically downward just behind the columella and it is crossing the floor of the nose. So it is passing the columella and it is crossing the floor of the nose. It is a common source of venous bleeding in young people. So you see here, this retrocolumnar vein is the cause of venous bleeding in the young people. We are going to deal in detail about the causes of epistaxis. The causes of epistaxis are basically divided into two types, the local causes and general causes. Starting with the local causes, which is involving the nose, paranasal sinus and nasopharynx. Trauma, like I told you, fingernail trauma, obsessive compulsive disorder, which means the person keeps on repeatedly doing the same thing. Okay, it is obsessive, he's obsessed with it. It is a compulsive disorder, obsessive compulsive disorder, which is causing a trauma. Injuries of the nose, that is an accidental injury or homicidal, or during surgery if they are causing some injury to the nose, can result in bleeding, that is epistaxis. Maxillofacial trauma, head injuries. Head injuries, we know a symptom of head injury is epistaxis. Nasal intubation, so whenever they are inserting the tube, they can lead to epistaxis when they are handling it roughly. Foreign bodies, rhinolith, a stone, blowing of nose too hard and also the violent sneezing can result in epistaxis. Hope the local causes are clear. The trauma, injury, maxillofacial trauma, head injury, nasal intubation, foreign body, rhinolith, blowing nose and also the frequent sneezing. Then going into the details of each of the types. Infections will include rhinitis. So we need to know, just knowing the term is not sufficient. We need to know what it actually means and then how it is resulting in epistaxis. All these infections will cause epistaxis. They are talking about rhinitis here. So from the name itself, you know, itis. Itis is the inflammation. Inflammation of the mucous membrane of the nose, which is caused by the viral infection. Then they are talking about sinusitis. Sinusitis is also the inflammation of a nasal sinus. Adenoitis, whenever there is an inflammation of the adenoid tissue. Then comes diphtheria, where a false membrane is formed in the nose resulting in epistaxis. Pyogenic granuloma. What are pyogenic granuloma, guys? These are nothing but the small raised red bumps on the skin. Okay, you can see in the picture here in the nose, the small red bump which is formed in the nose is nothing but pyogenic granuloma. Then they are talking about rhinosporidiosis. I have explained in detail about it in the previous video. You can check it in the the playlist. Rhinosporidiosis. Then they're talking about granulomatous lesions. Granulomatous lesions will include the tuberculosis, syphilis. So in these conditions, you see the granulomous lesions. After the inflammation, a granuloma is formed. And then sarcoidosis. Sarcoidosis, it is a disease which is characterized by the tiny collections of granulomas. Okay, here also, it is also a granulomatous disease. And then Wegener's granuloma. What is Wegener's granuloma? Here there will be inflammation of the blood vessels in the nose and then sinuses and so on. Okay, atrophic rhinitis, rhinitis sicca, maggots, leeches, neglected foreign body. You can see the multiple maggots which are given in the picture here. And then they spoke about rhinitis sicca. Atrophic rhinitis is nothing but the reduction in the mucous membrane which is caused because of the viral infection. Then they are talking about rhinitis sicca. Rhinitis sicca is a chronic inflammation in the region of the anterior part of the nose. Okay. So guys, infections, all the infections which are related to the nose and then the sinuses. Okay. Rhinitis, sinusitis, adenitis, diphtheria, the pyogenic granulomas, and then sarcoidosis, Wegener's granuloma. Then the rhinitis sicca, they're also talking about the maggots and the leeches. And if a neglected foreign body, if a person has got some foreign body, like a child just playing and he's put some groundnut or something like that, a kind of any foreign body into his nose, and then it is left on for a prolonged period without treating it, and eventually it will result in epistaxis. Okay. Now we move on to the next type, that is the neoplasms. Okay, the second cause, neoplasms. The neoplasms could be a benign, which is a localized neoplasm. Hemangioma. Hemangioma is what? A benign vascular tumor. Hem, from the word hem only you can make out that they are talking about the vascular tumor. Inverted papilloma. What is an inverted papilloma? This is also a benign, and it's coming under benign, the heading benign, so we know it's benign, but it is aggressive tumor. It will arise from the nasal cavity and also from the paranasal sinuses. Juvenile angiofibroma. Angiofibroma, it is nothing but the tumor which is formed in the blood vessels, okay, and also from the fibrous connective tissue. Angio, blood vessels, fibro, in the fibrous tissue. Aneurysms, we know that's the ballooning of the arteries. Encephalocele. So encephalocele is a sac-like protrusion. Now you can see in the picture here beautifully a baby which is having a sac-like projection of the brain, and also the membranes of the brain are going to be projected here. It is in the opening of the skull. Okay, you can see here. This is encephalocele. Okay. Now we move on to the malignant conditions. The malignant conditions are epidermoid carcinoma, adenocarcinoma, and sarcoma. Okay. Environmental factors like high altitude, sudden decompression, it is also known as Casson's disease, chemicals and pollution. So, in high altitudes, people will have epistaxis. The chemicals, the pollutions can also cause epistaxis. Here they're talking about the sudden decompression syndrome. Basically, what happens in this is, it is a neurological emergency which is found in drivers. It is because of the release of the nitrogen gas. Then this nitrogen gas will affect the blood vessels and also the brain. It will cause the neurological deficiency. Now here in the picture you can see the nitrogen travels under high pressure from the lungs to the blood, and from the lungs to the blood, after that the swimmer is trying to go up real fast, but the nitrogen is not leaving the blood and it is forming the bubbles. Okay. Then we move on. What you have to remember in decompression syndrome is that it is a neurological emergency. Okay. And then there will be accumulation of nitrogen gas. There will be release of nitrogen gas which is affecting the blood vessels. Then once they affect the blood vessels, epistaxis occur. Now we move on to the next thing, that is drugs. Nasal sprays, drops of antihistaminics and steroids. So the drugs like nasal sprays, prolonged use of some nasal sprays like antihistaminics, these can also result in epistaxis. Sniffing of the cocaine and snuff. You can see in the picture they are sniffing the cocaine sniffing, and then sniffing, and all these can lead to epistaxis. The miscellaneous conditions which can cause epistaxis is the septal deformity. So here they are talking about deviated nasal septum, which we dealt in detail, the septal deformity and also the perforations. Okay. Then we move on to the next cause. Now we are dealing with the systemic causes. Okay, each and every system you need to imagine. Think about the heart. What all conditions can occur which will result in epistaxis? In the heart, it could be hypertension, mitral stenosis. So whenever there is a narrowing of the valve which is present between the left heart chambers, right? So you can see in the picture here, the mitral stenosis, this is a mitral valve, left heart chamber. Whenever the valve is being narrowed, it is causing epistaxis, hypertension and then epistaxis. Congestive heart failure, eclampsia of pregnancy. So guys, eclampsia from your OBG. Eclampsia is nothing but the scissors which are occurring during a woman's pregnancy. There will also be proteinuria, edema. And then tumors of mediastinum. So the mediastinal tumors are nothing but the growths which are formed in the area of the mediastinum, which is causing a raised venous pressure resulting in epistaxis. So these are about the cardiovascular causes: hypertension, mitral stenosis, congestive heart failure, eclampsia of the pregnancy, and the tumors of the mediastinum. Now we move on to the next cause, that is hemopoietic, that is relating to the blood. Aplastic anemia. So you know from your physiology, aplastic anemia, what it means. What happens here, there will be deficiency of all the types of blood cells. It is caused by failure of the bone marrow development. You can see here the bone marrow, this is about the myeloma. So aplastic anemia, all the blood cells are going to be affected because of the bone marrow. Then leukemia, in which again the bone marrow and other organs which will produce the abnormal leukocytes. In leukemia, what's happening, the WBC level is going to increase. Abnormal leukocytes, immature leukocytes are going to be produced. Thrombocytopenia and vascular purpura. Here they are talking about thrombocytopenic and vascular purpura. Then we move on. Coagulopathies. What are those coagulopathies? Those are nothing but they have some problem in the clotting. Okay. And then hemophilia. Hemophilia, it is an inherited disorder in which the clotting process is affected. Then Christmas disease. Here something peculiar they are saying, Christmas disease. The Christmas disease is also popularly known as hemophilia B. Okay. One, that is hemophilia. The Christmas disease is popularly known as hemophilia B. It is because of the absence of a factor 9, a clotting factor 9. Or either there will be some defect in the clotting factor 9 which will result in Christmas disease. Then polycythemia vera. Polycythemia vera is a kind of blood cancer. It will also affect the bone marrow to make many immature red blood cells. You can see here in the picture. Then abnormal, like in case you imagine this to be the polycythemia vera, and then the blood bone marrow is affected and abnormal red blood cells will be produced. Then in multiple myeloma, it is a cancer which is forming the white blood cell, which is a type of a white blood cell called as a plasma cell. It is producing abnormal plasma cells which are similar to the white blood cells. Okay, the hemopoietic causes, the in detail you need not write, but then you need to know what it means. So aplastic anemia, all the blood cells are affected. Leukemia, more white blood cells. Thrombocytopenia with the platelet and vascular purpura. Coagulopathy, then clotting disorder. Hemophilia, also clot problem. Christmas disease, factor 9, clotting factor is absent. Polycythemia vera, we saw it is a blood cancer. Too many red blood cells will be produced. Polycythemia, many red blood cells are produced. Multiple myeloma, they are talking about a bone marrow disorder again, which is producing a type of a plasma cell which is similar to the white blood cell. Now we move on to the next cause, nutritional cause. Nutritional, you have to see malnutrition, scurvy, alcohol abuse, vitamin A, D, C, E and K deficiencies, and also the high doses of vitamin E. Okay, that's simple. Now we move on to the blood vessels, arteriosclerosis, collagen disease and HTT. So we know arteriosclerosis, there will be fat, cholesterol in the artery valves. And then collagen disease, it is a connective tissue disorder. Hereditary hemorrhagic telangiectasis, it is a HHE. It is some kind of hereditary disease in which the blood vessels will be affected. Okay. Liver diseases, hepatic cirrhosis. There is a deficiency of the factor 2, 7, 9 and 10. So in hepatic cirrhosis, what happens? The liver is going to be fibrosed and scarring will take place. Liver scarring in case of liver disease, which is resulting in epistaxis. Then we move on to the kidney diseases, chronic nephritis and renal failure. You see in chronic nephritis what's happening. The picture here it's given. Inflammation of the glomeruli and of the small blood vessels. This is glomerulonephritis. So inflammation of the glomerular nephrons. Okay. Then renal failure. This is about the kidney diseases resulting in epistaxis. Then we come to the drugs. Drugs like aspirin, non-steroidal anti-inflammatory drugs, NSAIDs. The popularly NSAIDs which will cause the epistaxis is ibuprofen and diclofenac. Anticoagulant therapy like heparin and coumadin can also cause epistaxis. Then the acute infections like influenza, measles. So influenza is a viral infection, and then measles is also a viral infection popularly known as rubella, which is caused by the rubella virus. Chickenpox, everyone in our childhoods have suffered from chickenpox, so we know it very well, a viral infection. Whooping cough, rheumatic fever, infection, mononucleosis, typhoid, pneumonia, malaria, and dengue fever. Okay, the typhoid, pneumonia, malaria, dengue fever can also cause epistaxis. Here they're talking about infectious mononucleosis. So guys, mono, it is popularly known as mono, or some kissing in disease also. Okay, the glands are going to be affected here, the tonsils and all those. Okay, so with this we come to an end of the causes of epistaxis. I hope it's clear. We can just do a quick revision, and then the causes we saw: local and general. Local was trauma, injury, and then intubation, foreign body. We saw the various type of infections of the nasal cavity and the sinuses. The neoplasms, benign and malignant. Environmental causes, and then drugs, miscellaneous, the septal deformities, cardiovascular, which we dealt in detail, hemopoietic disorders, nutritional effects, blood vessels. In blood vessels, arteriosclerosis, collagen diseases. I did not tell you about the collagen disease. Those are nothing but the diseases which are affecting the connective tissues, okay, like rheumatoid arthritis, systemic lupus erythematosus, and so on. And then liver diseases, kidney diseases, drugs, and acute infections. So I hope it's clear.